Medical tourism, which is a euphemism for free trade in healthcare, has allowed patients around the world facing certain death at home to receive life-saving treatments abroad. Now, with the double whammy of Obamacare and a rapidly aging population, which will create major healthcare shortages in the US, foreign hospitals are anticipating big business in treating Americans.
The growth of American-style hospitals around the world has been geometric in the last 8 to 10 years.
Joseph Woodman is the CEO of Patients Beyond Borders and the author of several guidebooks to the medical tourism industry.
You're going to see just huge competitive forces coming to bear on the U.S. healthcare system, and God knows we need it.
Foreign governments and hospitals are staking big dollars on promotion and infrastructure in an effort to burnish their reputations as medical destinations. That enthusiasm was on display last October at a medical tourism industry conference in Florida, which drew participants from 90 countries.
Obamacare will be a boon for us because access to care is going to be much more difficult in the future. It's already difficult.
Dr. Sam Hess is part of a group that's working to set up a full-service hospital on the Caribbean island of St. Martin. He says Obamacare will magnify the bureaucratic and legal headaches that take up so much time when he practices in the U.S.
We have to assign more and more of our staff just to be able to address insurance concerns and approvals, things like that. And so patients often look elsewhere who are self-insured because they can have the same procedure done at a much lower cost.
Most of the best hospitals outside the United States tend to be better run. The payment is out of pocket and the hospitals have to perform. Insurance has not infected the rest of the world, and so it's more of a buy and sell proposition. And if a hospital wants to make money, there needs to be accountability all the way up and down the line.
In other countries, the prices for major procedures run on average about 1/3 what U.S. hospitals charge.
I think that medical tourism will inspire competition, and competition is good for all of us.
Floating hospitals that aren't tied to any particular country, such as those run by the charitable organization Mercy Ships, may provide another disruption to our overly regulated healthcare industry. Dr. Mohammed Saeem is a veteran medical director for the cruise industry.
With the flag of convenience, it opens for you to hire from anywhere. I have doctors from Poland, France, from Germany, Spain. You cannot do that automatically in any country due to immigration rules, due to employment rules, due to protectionism to protect our own market. So there are a lot of considerations.
As Obamacare makes high-quality healthcare more difficult to come by, many Americans will forego their insurance coverage and simply pay out of pocket for better and immediate treatment abroad. That's exactly what's happened in Canada.
Why Canadians want to travel is because our socialized 100% universal healthcare system is not working.
Keith Harrison is a nurse for hire who cares for patients traveling out of Canada, where the average wait time is 4 months for all non-emergency procedures.
What ends up happening is you got a non-life-threatening issue becoming a life-threatening issue, and then all of a sudden they get treatment, but that can be a year. So now people with health problems are starting to put initiative in their own hands.
Joseph Woodman says ultimately the greatest benefit of foreign competition will be to make U.S. healthcare better.
Just like 40 years ago when the Japanese entered the marketplace with far superior cars at a lower price, at first they were ridiculed and they ate our lunch. And just when Detroit was perfecting planned obsolescence, they had to start building cars that went 70,000 miles without a lot of maintenance. And you've got those very same people now competing for healthcare. You're going to see a lot of healthcare institutions getting off their duff and responding. It's already beginning to happen.